How?
Pharmacology of Peptic Ulcer Disease, PUD. Hey everyone! Welcome back to our channel. Today, we're diving into a fascinating topic in the world of medicine, pharmacology related to peptic ulcer disease, or PUD for short. If you've ever wondered how medications work to treat ulcers in the stomach and intestines, you're in the right place. So, let's get started. First off, what exactly is peptic ulcer disease? Well, PUD refers to sores that develop on the lining of the stomach or the first part of the small intestine. They can be caused by various factors, including the bacteria Helicobacter pylori, excessive use of nonsteroidal anti-inflammatory drugs, or even stress. Now, let's talk about the pharmacological treatments available for PUD. The main goal of these medications is to reduce stomach acid, promote healing, and prevent complications. The most commonly used drugs fall into a few key categories. 1. Proton pump inhibitors, PPIs. First up, we have proton pump inhibitors, or PPIs. These medications, like omeprazole and lansoprazole, work by blocking the proton pump in the stomach lining. This pump is responsible for producing stomach acid. By inhibiting it, PPIs significantly lower acid levels, allowing ulcers to heal more effectively. 2. Antacids. Next, we have antacids. These are over-the-counter medications that neutralize stomach acid. Think of them as a quick fix for heartburn and indigestion. They provide rapid relief but don't promote long-term healing like PPIs do. 3. H2 receptor antagonists. Then, we have H2 receptor antagonists, such as ranitidine and famotidine. These drugs also reduce stomach acid but do so by blocking histamine receptors in the stomach. They're effective but generally not as potent as PPIs. 4. Antibiotics. And let's not forget antibiotics. If your ulcer is caused by H. pylori, your doctor will likely prescribe a course of antibiotics to eradicate the bacteria. This is crucial because treating the infection can lead to ulcer healing and prevent recurrence. Now, you might be wondering, how do we know which medication is best for a particular patient? This is where pharmacogenetics comes into play. Pharmacogenetics studies how our genes affect our response to medications. For instance, some individuals metabolize drugs differently due to genetic variations, which can influence the effectiveness and safety of treatments. 5. Drug interactions. Another important aspect to consider is drug interactions. For example, if a patient is taking clopidogrel, a common blood thinner, and a PPI like omeprazole, there can be significant interactions that affect how well these drugs work. Understanding these interactions is vital for optimizing treatment plans. 6. Side effects and risks. Lastly, it's essential to talk about potential side effects. Long-term use of PPIs, for instance, has been linked to risks like low magnesium levels and increased susceptibility to certain infections. So, while these medications are effective, monitoring and managing side effects is crucial. In summary, the pharmacology of peptic ulcer disease involves a range of medications that work together to reduce stomach acid, promote healing, and address underlying causes. Understanding these treatments and their implications, including pharmacogenetics and drug interactions, is key to successful management. Now let's dive into the interaction between clopidogrel and proton pump inhibitors, or PPIs. First off, let's break down what clopidogrel is. Clopidogrel, commonly known by its brand name Plavix, is an antiplatelet medication. It's often prescribed to prevent blood clots in patients with heart conditions, like those who've had a heart attack or stroke. Now, on to PPIs. Proton pump inhibitors, such as omeprazole, esomeprazole, and lansoprazole, are medications that reduce stomach acid. They're typically used to treat conditions like gastroesophageal reflux disease, or GERD. So, why should we be concerned about the interaction between these two types of medications? Here's where it gets interesting. When clopidogrel is taken alongside PPIs, it can significantly reduce the effectiveness of clopidogrel. You see, clopidogrel is a prodrug. This means it needs to be converted into its active form in the body to work effectively. This conversion is primarily done by an enzyme called CYP2C19, which is found in the liver. Now, PPIs, particularly omeprazole, can inhibit this enzyme. When CYP2C19 is inhibited, the conversion of clopidogrel into its active form is reduced. This leads to decreased antiplatelet activity, meaning that patients may be at a higher risk for cardiovascular events, like heart attacks or strokes, because the blood isn't being thinned effectively. Research has shown that patients who are on both clopidogrel and PPIs may experience worse outcomes compared to those who take clopidogrel alone. This interaction is particularly important for healthcare providers to consider when prescribing these medications together. So, what can patients do? If you're taking clopidogrel and a PPI, it's crucial to have a conversation with your healthcare provider. They might suggest alternative medications or adjust your treatment plan to ensure you get the best care possible. In summary, while both clopidogrel and PPIs serve important roles in managing health conditions, their interaction can pose risks that should not be overlooked. Always keep your healthcare team informed about all the medications you're taking. Thanks for tuning in. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more insights into the world of pharmacology. Stay healthy, and see you next time.
Pharmacology.